A free health campaign organized by NTECKA Holding Incorporation in partnership with Health Foundation was held on Sunday, December 21st at the Lukudu Douala Hall Ground Gabonaberi, Douala. The initiative focused on heart-related diseases and offered free medical consultations to residents. The program began at 10 a.m. and attracted members of Lebang and Lebialen communities as well as residents from across Douala. Medical professionals conducted blood pressure and cholesterol checks and provided health advice with emphasis on early detection and prevention. Several participants said the campaign gave them access to health care they could not otherwise afford.
Tem que ter filho. A moga de a que não ande me. Time só moga que campanha faria. Vou mbese be. Vou keke. Keme kumari inja. Mo gastro. Me ba que je boza. Man good treatment.
I'm called Madam Irene Tunafe Mebo, resident here in Douala. We have come here today for the checkup being called by Mr. Tintin Charles. So I'm a high blood patient, so I've come to check my blood. Even though in my house I have my machine that I used to check myself, but I'm not really sure. Since there is a campaign here today, I've decided to come to have more information from them, whether if my drugs that I've been taking is okay, or they can add some, or the one that I've been taking is okay for me, then they will tell me what to do.
The CEO of NTECKA Holding Incorporation stated that the initiative reflects the company's commitment to community service and improving access to healthcare for undeserved populations.
My name is Charles Dentino. My traditional name is Kemtongo. I'm here in Banaberi for the biometric screening for the Kudo Douala. I've been doing this for several years up to now. So my purpose of getting this screening being done in Douala because it's a community which I've lived with before I went to the United States. I want them to live healthy. All this while, and I've been doing this, and I've been explaining to them that it's good to know your numbers, your healthy numbers, especially your blood pressure, your glucose, and your cardio system, because this is what we entail. The white man does this every time in order to live long, and I've envisaged this for my community. Thank you. For me to see, very importantly, that you're asking about envisage, is for me to see my community live so happily and healthy and live longer. For the past years, I think the death rates have reduced, especially in this community. Yeah, for you to just see like this and see somebody pass away, and you begin to wonder what is happening. It's not by chance, it's not just like that, but because people they don't take care of their health properly, they don't take notice. And the notice is just what we are doing, especially the blood pressure that comes in.
We also had the opportunity to interview the president and CEO of Health Foundation, who shared insights into reasons for their ongoing partnership with NTECKA Holding Incorporation. He emphasized that their collaboration is driven by a shared mission to enhance community health and ensure that vital medical services reach those in need. The partnership allows both organizations to leverage their resources effectively, maximizing their impact on public health.
I am Kengacha Marcellus Agendia, the President and CEO of HELH Foundation, a health humanitarian organization that has as a vision to empower our communities to have full control over their health and over disease-related determinants. We have been partnering for some years now with NTECKA Holding, a US-based organization, because simply they have a similar vision like us, and we find it very important to work together for the betterment of our community members. Today we are in Ganga, and we are carrying out a cardiometabolic health campaign, which is basically to screen people of diseases that are related to cardiometabolic health, that is diabetes, high blood pressure, stroke, high cholesterol, and you can name the rest. So everything is going on well, and we really appreciate the community members for their turnout. Compared to previous years, people are really becoming more aware of what we are doing. I also want to seize the opportunity to thank our volunteers who are carrying out this entire screening process passionately. So that is basically what I can say for now.
Volunteers and healthcare workers played a key role in the success of the event.
Manager of NTECKA Medical Center and Diagnostic Laboratory based in Ancien Route, Bonaberi, quite close to Abu Tokyo nightclub. Yes, in fact, as far as our services are concerned as a medical center, we are also very concerned about metabolic health of the people. Talking about cardiometabolic health during this special campaign has to do with trying to help the people understand those diseases that can be related to their lifestyle, how they eat, what they drink, even social activity. And so our concern is lifestyle modification. When you do lifestyle modification, you can be able to avoid diseases like high blood pressure, diabetes, high cholesterol, and even stroke, which is a complication of hypertension. So in this case, in this health campaign, our goal, which is also going to help the people have a free knowledge of what cardiometabolic diseases are, is to screen any number of people to be able to know their conditions, whether they are diabetics or they are hypertensive or they have high cholesterol. And just as you see, cardiometabolic has to do with metabolism that goes on because we eat. Some people overeat, some people are undernourished, and some people overdrink, and this gets into complications. And for that reason, it's just as a matter of educating the people to know better what they have to do to modify their lifestyle.
Many participants left expressing gratitude for the free services received.
We are very grateful to the World Medical Relief for sponsoring this metabolic campaign. It is something which is very important because we know most of our people, they live with cardiovascular disease, they are not aware. So a screening like this will help us to be able to know our numbers and be able to live a better lifestyle to avoid cardiovascular diseases.
BP, sugar, then we want your doctor. We your doctor result that but then can be one special issue. Women doctor usually fege hospital ye ngondo over German kajari so ndrotema ona chapter biele bang ngu bufu motanzabo obulangina be ndabasi bulu kam di state wo ba bapo since ba mo betar we as a ngu for free mo 5 francs you pay at the whole so any more food go lo ko ba ko food using chen ne do using ngwala je we to ba go fine go conte
Ken Nicoli, student reporter for Gaza Media, reporting from Douala.